Welcome back to the In the Clinic podcast with Rob. And if you are looking for 7 tips to improve your balance, which means you can maintain your mobility and independence even into your 90s, then this is the video for you. Because today we're going to dovetail into all the factors that are required to maintain your balance as you age. Because it's important, it's essential for you to get the most out of your life. So before we get started, for those of you that are new to this channel or to this podcast, please note that my name is Rob Sumner. I own Sumner Specialized Physical Therapy and Specialized Strength. I really just do these videos mainly because there are a ton of people out there that are in pain, that are lacking mobility, that do not have independence in their life. And I really don't want you to be one of them. So I'm really just looking to improve your life in any other way that I can. And if I'm able to even help one person, man, that means the world to me. So with that being said, I really don't have much to sell you other than giving you some really sound advice on how to improve your life. So let's get started. So today we're really dovetailing into what balance is, and we're really looking at 7 other factors besides the inner ear and some of the standard ones, eyes, that people understand why we get our balance. But there are some certain factors that really play a pivotal part in whether somebody is going to age gracefully. And we talk about aging gracefully often and why it matters, because you hear people say, gosh, I'd hate to live to 100. Ugh, I don't want to live to be 100. Well, why do people say that? Why, if you could be in your 30-year-old body for the rest of your life, would you want to be 100? Some of you probably say, darn right. I'd live to, in my 20s and 30s all day, every day, and I would love it. Because why? Because usually in your 20s and 30s, you have some of your best mobility, your independence, your mind sharp. You are in some of the best shape of your life. And so when you really look at that time frame, you are at the mix between understanding how the world works and your own education and having a concept of life, but also physically, you're fully mature and your brain's fully mature and you're able to make better decisions and you're able to consciously improve your health and fitness and other. So when you look at people in their 30s, 20s and 30s, they like that time frame. And when people reminisce about the good old days when they were young, it usually has to do with they felt they had energy. They could get a lot of things done. Were very mobile. They could do what they wanted to. But what happens when we get older? Well, we start finding that, hey, it's harder to move. It takes more energy just to do the same amount of activity. Just going to the grocery store, I got to lean on the cart a lot because take pressure off my hip or my back pain. Oh, I find that going up a flight of stairs, now I'm super winded, whereas before I used to double skip them. So when you start looking at aging gracefully, why wouldn't you want to be 100 if you could move like a 30-year-old? So overall, what we're really trying to get into is how do you want to live your life? That's what it really comes down to. It really comes down to how do you want to live your life? So for us, we're really looking to improve that in multiple ways. And there's a couple ways that we can do it. One of the primary ways is improving your balance. I mean, that's really what we're trying to do. Because these 7 factors, if you can improve these in an indirect way, it affects your balance and improves your balance. So really, let's get into these factors. What are some of the factors that are pivotal for you to improve your overall balance to your body? Okay, number 1, your strength. The amount of force that any individual has, particularly in the lower body, will be a primary factor in your balance. And I mean, oftentimes in the clinic, we're treating patients who are a fall risk. And we do this mainly with strengthening programs. Strength is one of the most critical factors in determining if the body will have the ability to respond to any demands in the environment. So strength is essential, and it's something that we try and gain for people when they have an increased risk for falling. What dovetails into strength is endurance. You look at many large department stores, different grocery stores, malls, parks, they have benches for sitting. And that's for a good reason, because increased activity of just a constant duration leads a lot to fatigue. And so when the surrounding muscles of the lower leg become fatigued, the ability to respond to a demand in your environment becomes really difficult. So a lot of individuals who are at risk for falling also have low endurance. Low endurance. Number 3, coordination. So one of these factors that affects balance is coordination. And from the brain to the brain stem to the spinal cord, these all make the central nervous system. And the central nervous system really controls the peripheral nerves that run down your legs and your arms. So your ability to process information, create a fluid movement, run through the full system, it's essential that you have a functioning central nervous system. So if you damage any part of your central nervous system through a spinal cord or brain injury, it's really difficult to coordinate your tasks or your actions or maintain your balance. And that's why you see individuals after a stroke, which is an attack on your brain, which is part of your central nervous system. It's hard to maintain your balance because your coordination is not there because you've damaged part of that tract. So coordination is essential for balance. Number 4 is flexibility. Now, each joint has a particular available motion necessary to allow the movement to occur and to have it occur fluidly. Specific motion is required for your balance to really make it happen. And when compromised, it truly affects your balance. So limited ankle, knee, hip, or back mobility will affect the body's ability to really maintain efficient posture. So poor posture leads to premature fatigue or a less stable position for balance. So maintaining proper mobility in your joints is essential for your balance. If you're constantly resting on the end stages of your ligaments or of your joints, you're out of alignment, which is going to prevent you from maintaining your balance or being efficient with your strength. Number 5 is pain. So pain prevents movement overall, and anybody that's in pain knows that. And you can see pain because people start walking and moving differently. They limp, they hold their body part, they try and take pressure off things. And the stimulation provided to the brain is a negative feedback loop. And that results in inactivity. But pain also limits walking efficiency. So the pain will require you to walk differently, creating instability with balance or create premature fatigue. And fatigue, as discussed earlier, affects all balance. So pain is a big, big indicator too. Number 6 is medication. One standard during our clinic evaluations is to review drug medications and to identify if people are high risk of falling just based on the medications that they're taking. Certain medications can create dizziness, different antidepressants, blood pressure medications, muscle relaxants, and different medications for peripheral neuropathy, fibromyalgia, epilepsy. These are just a few that can affect your balance. So reviewing your overall medication list can be impactful as well to your balance. And that leads to our last one, which is number 7, which is sensation. So when you're looking at sensation overall, your ability to use your feet for feedback when too much pressure is on your heel, when you're falling backwards, or when there's too much pressure on your forefoot when you're falling forward, it's important that you can feel that. because different disorders disrupting those foot nerves, such as like diabetes or peripheral neuropathy, the numbness that doesn't allow you to fully receive that feedback, which throws off your balance. You can't feel and respond to it properly until it's too late. So overall, there's your seven factors that really affect your balance. So when you're looking at those, what really matters? Well, strength's essential, because without strength, you can't maintain your balance. Mobility is pivotal, because if you are constantly at your end ranges and you're having to hunch forward, then you're out of alignment and neutral posture. So it's really important overall to look at each one of these. From your mobility, flexibility, pain. If pain's going to prevent you from moving properly, and it's going to affect your balance. Different sensation to your feet. So overall, rounding out, well, what are we really talking about? We're talking about the fact that if you can improve these 7 things, it's really going to allow you to improve your balance overall, which really means that you can maintain your mobility, independence, function, even into your 90s. Even into your 90s. And that's really important, because we don't want to live one life. We want to live our best life as long as we can. We want to have the best life that we can for as long as we can. You know, I hear the youngsters say, YOLO. You only live once, which is an excuse for making erratic behavior. Well, I do. Yeah, I only want to live once. We know that, but I want to live really well for the whole life, not just a short period of time. I don't want to be reckless with my body and the life that I have, and put me at risk that can prevent my full mobility and independence and longevity for just living in a moment. So when people really talk about YOLO, I'm sensitive to that, because I want to live the best life the whole life, not just for a short period of time. So the best way you can truly live your life is to give yourself the gift of mobility, balance, and strength, flexibility, and you do that through an assortment of ways that from your wellness spectrum. Nutrition, mental health, strength training, taking care of injuries, not ignoring different medical issues, staying on top of and being proactive in your own health care. So overall, if you're looking to develop the best life that you can for the longest period of time, all the way even to your 90s or 100s, get on it now. It's never too late to get going and try to improve your health and your wellness and your overall fitness level. And every ounce that you gain will only pay dividends to you in your life. So overall, for those listening today, I appreciate you listening fully to this podcast and this video. If you're watching this on YouTube, definitely hit subscribe. Definitely leave me a comment on what you think of this video, and if it helped you and gave you value, then that way I can decide if it will help other people in the future. If you're listening on a podcast, Spotify, any type of Apple Podcasts, definitely subscribe, definitely leave me a comment as well, and give me your thoughts, because each one of those are gold to me. I love listening and reading different comments from the people out there listening to these. So again, all in all, improve your life, improve your balance, improve your mobility and independence way into your 90s. And again, I hope this video found value for you. So other than that, I'm out. I'll see you next time.